Why do we have to rethink health? Because it's pretty fundamental to everybody. So there aren't a lot of things in our culture that, you know, if you improve that, you are potentially doing something for everybody. Thirdly, and the thing that is going to finally allow us to do some serious application of our rethinking, I hope, is because it will bankrupt every province. And the analysts have been able to show for some time that the increasing costs of running a health system the way we do it now with an aging population is not sustainable. But for whatever reason, as they say, health discussions have become the third rail in Canadian politics, so no Canadian politician has wanted to do anything more but argue for more money. I would say that for the first time since Tommy Douglas's days, politicians now appear to be forced to talk about rethinking health because the reality of the unsustainability of the budget implications is becoming just too clear. So we have created a fine health system that showed the best of our compassion, that families should not go bankrupt because somebody got a debilitating disease. And we've done our best to make that a bedrock of Canadian culture, and I'm quite proud of that. But it has led us to think not so much of health, but of medicine. And so the concentration of the system has been on the delivery of services when you are sick, instead of helping people to stay healthy. And therefore it has been dominated by, not surprisingly, physicians. And so we have a reasonably expensive healthcare system, which we prided ourselves for years as being the best in the world. And anybody who pays any attention to hard data of all sorts has had to acknowledge over the last 10 years that we rank somewhere between 20 and 30 in the world in terms of the return on investment, the quality of care we get for the money we invest. In fact, among Western nations, the only country that we beat on many of the scores is the United States. And they beat us on the quality of top technology for health, which is, for many of us, somehow got distorted into being one of the real measures of health. So we've got a mixed up story of health, and whereas much of the world had to concentrate on primary health care because they didn't have the resources that we had, we got concentrating more on hospital care as the kind of measuring point. So now we realize that to really do the best for all of us, we are looking to how do we create community-driven, integrated, IT-enabled health and wellness systems as a focal point along with the building of medical institutions to help those who are seriously ill. That's a huge cultural shift. It has to battle many professional jealousies and in some cases self-serving regulations. So you have to start looking to other parts of the world that have broken out of those constraints, and there are some great models around the world. And so again, what I get excited about is how do you bring some laboratory examples from communities around the world in order to encourage communities in Canada that are trying on their own to practice one of these community-driven health and wellness approaches.